The nurse is admitting a patient to the hospital. The patient is a very spiritual person but does not practice any specific religion. How will the nurse interpret this finding? A. This indicates a strong religious affiliation. B. This statement is contradictory. C. This statement is reasonable. D. This indicates a lack of hope. Answer: C. This statement is reasonable. Rationale: the patient's statement is reasonable and is not contradictory. Many people tend to use the terms spirituality and religion interchangeably. Although closely associated, these terms are not synonymous. Religious practices encompass spirituality, but spirituality does not need to include religious practice. When a person has the attitude of something to live for and look forward to, hope is present. The nurse is caring for an Islam patient who wants a snack. Which action by the nurse is most appropriate? A. Offers a ham sandwich. B. Offers a beef sandwich. C. Offers a kosher sandwich. D. Offers a bacon sandwich. Answer: B. Offers a beef sandwich. Rationale: Islam religion does allow beef. Islam does not allow pork or alcohol. Ham and bacon are pork. Kosher is allowed for Judaism. A nurse is teaching a patient how to meditate. Which information from the patient indicates effective learning? A. I will lie on the floor. B. I will breathe quickly. C. I will focus on an image. D. I will do this for 10 minutes every day. Answer: C. I will focus on an image. Rationale: the steps of meditation include sitting in a comfortable position with the back straight, breathe slowly, and focus on a sound, prayer, or image. Meditation should occur for 10 to 20 minutes twice a day. The nurse and the patient have the same religious affiliation. Which action will the nurse take? A. Must use a formal assessment tool to determine patient's beliefs. B. Assume that both have the same spiritual beliefs. C. Do not impose personal values on the patient. D. Skip the spiritual belief assessment. Answer: C. Do not impose personal values on the patient. Rationale: it is important not to impose personal value systems on the patient. This is particularly true when the patient's values and beliefs are similar to those of the nurse, because it then becomes very easy to make false assumptions. It is not a must to use a formal assessment tool when assessing a patient's beliefs. It is important to conduct the spiritual belief assessment. Conducting an assessment is therapeutic because it expresses a level of caring and support. A nurse is caring for a Hindu patient. Which action will the nurse take? A. Allow time to practice the 5 pillars. B. Allow time to practice blessing way. C. Allow time for Holy Communion. D. Allow time for purity rituals. Answer: D. Allow time for purity rituals. Rationale: Hindus practice prayer and purity rituals. Blessing way is a practice of the Navajos that attempts to remove ill health by means of stories, songs, rituals, prayers, symbols, and sand paintings. Islams must be able to practice the 5 pillars of Islam. Holy Communion is practiced in the Christian religion. A nurse makes a connection with the patient when providing spiritual care. Which type of connectiveness did the nurse experience? A. Interpersonal. B. Interpersonal. C. Transpersonal. D. Multipersonal. Answer: B. Interpersonal. Rationale: interpersonal means connected with others in the environment. Interpersonal means connected within oneself. Transpersonal means connected with God or an unseen higher power. There is no such term as multi-personal for connectedness. A male patient in stable condition is in the intensive care unit (ICU) and is asking to see his spouse and 2 daughters. What should the nurse do? A. Allow only 5 to 10 minutes with the family. B. Allow the wife and daughters to visit at the patient's request. C. Allow the 2 daughters to visit and let the wife visit when they leave. D. Allow the wife and 1 daughter to enter the ICU but not the other daughter. Answer: B. Allow the wife and daughters to visit at the patient's request. Rationale: use of support systems is important in any health care setting. Allowing the family to visit is appropriate since the patient is in stable condition. When patients depend on family and friends for support, encourage them to visit the patient. As long as no interference with active patient care is involved, there is no reason to limit visitation. Limiting the visit is not necessary since the patient is stable. Breaking the family apart is not needed. The patient is stable and can see all 3 at once. The nurse is caring for a patient with a chronic illness who is having conflicts with beliefs. Which healthcare team member will the nurse ask to see this patient? A. The clergy. B. A psychiatrist. C. A social worker. D. An occupational therapist. Answer: A. The clergy. Rationale: other important resources to patients are spiritual advisors and members of the clergy. Spiritual care helps people identify meaning and purpose in life, look beyond the present, and maintain personal relationships as well as a relationship with a higher being or life force. A psychiatrist is for emotional health. A social worker focuses on social, financial, and community resources. An occupational therapist provides care with vocational issues and functioning within physical limitations. The nurse is caring for a patient with a terminal disease. The nurse sits down and lightly touches the patient's hand. Which technique is the nurse using? A. Doing for. B. Establishing presence. C. Offering transcendence. D. Providing health promotion. Answer: B. Establishing presence. Rationale: establishing presence by sitting with a patient to attentively listen to his or her feelings and situation, talking with the patient, crying with the patient, and simply offering time are powerful spiritual care approaches. Benner explains that presence involves being with a patient versus doing for a patient. Transcendence is the belief that a force outside of and greater than the person exists beyond the material world. In settings where health promotion activities occur, patients often need information, counseling, and guidance to make the necessary choices to remain healthy. The nurse is caring for a patient who has been diagnosed with a terminal illness. The patient states, "I just don't feel like going to work. I have no energy, and I can't eat or sleep." The patient shows no interest in taking part in the care by saying, "What's the use?" Which response by the nurse is best? A. It sounds like you have lost hope. B. It sounds like you have lost energy. C. It sounds like you have lost your appetite. D. It sounds like you have lost the ability to sleep. Answer: A. It sounds like you have lost hope. Rationale: all of the patient's description are describing a loss of hope, while losses of energy, appetite, and sleep are indicated. They only address a part of patient's problems. A loss of hope encompasses the holistic view of the patient. The patient is having a difficult time dealing with an AIDS diagnosis. The patient states, "It's not fair. I'm totally isolated from God and my family because of this. Even my father hates me for this. He won't even speak to me." What should the nurse do? A. Tell the patient to move on and focus on getting better. B. Use therapeutic communication to establish trust and caring. C. Assure the patient that the father will accept this situation soon. D. Point out that the patient has no control and that he or she must face the consequences. Answer B. Use therapeutic communication to establish trust and caring. Rationale. Application of therapeutic communication principles and caring helps you establish therapeutic trust with patients. The nurse should not offer false hope father will accept the situation soon. The nurse should help the patient maintain feelings of control, not no control. The nurse should encourage renewing relationships if possible and establishing connections with significant others, and God. A nurse hears the following comments from different patients. Which patient comment does the nurse identify as faith? A. I go to church every Sunday. B. I believe there is life after death. C. I have something to look forward to each day. D. I get a feeling of awe when looking at the sunset. Answer B. I believe there is life after death. Rationale. Faith allows people to have firm beliefs despite lack of physical evidence of life after death. Religion refers to the system of organized beliefs and worship that a person practices to outwardly express spirituality. Go to church. When a person has the attitude of something to live for and look forward to, hope is present, look forward to each day. Self-transcendence is the belief that there is a force outside of and greater than the person, when looking at a sunset. The patient is admitted with chronic anxiety. Which action is most appropriate for the nurse to take? A. Focus on finding quick remedies for the anxiety. B. Realize that the patient's only goal is relief of the anxiety. C. Look at how anxiety influences the patient's ability to function. D. Help the patient realize that there is little hope of relief from anxiety. Answer C. Look at how anxiety influences the patient's ability to function. Rationale. Do not just look at the patient's anxiety as a problem to solve with quick remedies, but rather look at how the anxiety influences the patient's ability to function and achieve goals established in life, not just anxiety relief. Mobilizing the patient's hope is central to a healing relationship. In caring for the patient's spiritual needs, the nurse asks 20 questions to assess the patient's relationship with God and a sense of life purpose and satisfaction. Which method is the nurse using? A. The Spiritual Well-Being Scale. B. The FICA Assessment Tool. C. Belief Tool. D. Hope Scale. Answer A. The Spiritual Well-Being Scale. Rationale. The Spiritual Well-Being Scale (SWB) has 20 questions that assess a patient's relationship with God and his or her sense of life purpose and life satisfaction. The FICA assessment tool evaluates spirituality and is closely correlated to quality of life. This does not describe belief or hope. A nurse is providing spiritual care to patients. Which action is essential for the nurse to take? A. Know one's own personal beliefs. B. Learn about other religions. C. Visit churches, temples, mosques, or synagogues. D. Travel to other areas that do not have the same beliefs. Answer A. Know one's own personal beliefs. Rationale. Because each person has a unique spirituality, you need to know your own beliefs so you are able to care for each patient without bias. While learning about religions, visiting other religious areas of worship, and traveling to areas that do not have the same beliefs are beneficial, they are not essential. The nurse is caring for a group of patients. Which patient will the nurse see first? A. A patient saying that God has left and there is no reason for living. B. A patient refusing treatment on the Sabbath. C. A patient having a folk healer in the room. D. A patient praying to Allah. Answer: A. A patient saying that God has left and there is no reason for living. Rationale: a patient saying that God has left and there is no reason for living must be seen first for safety reasons. It must be determined by the nurse if the patient is planning suicide or is just angry and frustrated. A patient refusing treatment on the Sabbath is within that patient's right and doesn't need to be seen first. A patient with a folk healer is within the patient's right and does not need to be seen first. A patient praying to Allah is within the patient's right and does not need to be seen first. Spiritual distress has been identified in a patient who has been diagnosed with a chronic illness. Which interventions will the nurse add to the care plan? Select all that apply. A. Offer to pray with the patient. B. Avoid time with the support group. C. Have the patient avoid church attendance. D. Develop activities to heal body, mind, and spirit. E. Teach relaxation, guided imagery, and meditation. Answer: A. Offer to pray with the patient. D. Develop activities to heal body, mind, and spirit. E. Teach relaxation, guided imagery, and meditation. Rationale: interventions that are appropriate for spiritual distress include 1. Helping the patient identify activities to heal body, mind, and spirit. 2. Offering to pray with the patient. And 3. Teaching relaxation, guided imagery, and medication. Attendance at church should be encouraged as well as spending time with a support group. A nurse is evaluating a patient's spiritual care. Which areas will the nurse include in the evaluation process? Select all that apply. A. Review the patient's view of the purpose in life. B. Ask whether the patient's expectations were met. C. Discuss with family and friends the patient's connectiveness. D. Review the patient's self-perception regarding spiritual health. E. Impress on the patient that spiritual health is permanent once obtained. Answer: A. Review the patient's view of the purpose in life. B. Ask whether the patient's expectations were met. C. Discuss with family and friends the patient's connectiveness. D. Review the patient's self-perception regarding spiritual health. Rationale: in evaluating care include a review of the patient's self-perception regarding spiritual health, the patient's view of his or her purpose in life, discussion with the family and friends about connectiveness, and determining whether the patient's expectations were met. Attainment of spiritual health is a lifelong goal. It is not permanent once obtained. The nurse is caring for a 16-year-old boy receiving chemotherapy for testicular cancer. He says that his parents are religious and left a cross next to his bed for good luck. What is the most appropriate response by the nurse? A. Would you like to talk with the chaplain? B. Sounds like you are not very religious. C. How well do you get along with your parents? D. What helps you get through tough times? Answer: D. What helps you get through tough times? Rationale: asking an open-ended question is the best response that the nurse can make to this patient's comment. It will encourage the patient to share what he thinks would be most supportive at this time. Asking the patient if he would like to talk with a chaplain is incongruent with his comment about having a cross for good luck. Sharing that he does not sound religious is judgmental, and asking about his relationship with his parents is changing the subject. The nurse is caring for a middle-aged patient with severe heart disease who is awaiting a heart transplant. The patient must stay in the hospital until the surgery or death occurs. The patient breaks down crying, saying, "I don't want this, and I just want to go home." What response by the nurse is best? A. If you go home, you know you will die. B. What can I do to make your hospital stay better? C. You don't have to do this. What do you want to do? D. Can I call the chaplain to come talk to you? Answer. C. You don't have to do this. What do you want to do? Rationale. The patient is in spiritual distress looking for meaning and purpose in this situation. The nurse is helping the patient search for meaning. What is the best way to provide spiritual care to a 2-year-old patient? A. Read a childhood story about good versus evil. B. Play hide and go seek and let the child find you every time. C. Let the toddler play with pretend medical supplies. D. Talk to the mother about special religious diets. Answer. A. Read a childhood story about good versus evil. Rationale. Toddlers need concrete examples of good versus evil to better understand meaning. A nurse is providing spiritual care to a group of patients. Match the group to their belief. A. Nature controls life and health. B. Organ transplantation or donation is not considered. C. Observance of the Sabbath is important. D. Past sins cause illness. E. Non-human spirits invading the body cause illness. 1. Hinduism 2. Buddhism 3. Islam 4. Judaism 5. Appalachians. You are caring for a 28-year-old married man diagnosed with leukemia. He is hospitalized on reverse isolation. It is his anniversary and his wife is planning to visit. What would be appropriate nursing care to promote spiritual health? A. Assist him in planning a celebration of his anniversary. B. Ensure he has adequate pain medication to endure the visit. C. Maintain strict reverse isolation to prevent infection. D. Congratulate the couple on their anniversary. Answer. A. Assist him in planning a celebration of his anniversary. Rationale. Celebrating their anniversary promotes hope, love, and compassion, while fostering spiritual connections between the husband and wife. What is transcendence? A. Out-of-body experience. B. A meditative state. C. A higher power. D. Spiritual growth over time. Answer. D. Spiritual growth over time. Rationale. Transcendence is moving beyond who you are toward who you will become. By definition, it is spiritual growth over space and time, or moving beyond one's current self. The nurse is caring for an 8-year-old who is receiving an intramuscular injection. The patient says, "You hurt me all the time. What did I do wrong?" What is the nurse's best response? A. You didn't do anything wrong. B. Why do you think you did anything wrong? C. Who told you that you did something wrong? D. It will only be a little bee sting.
Answer. B. Why do you think you did anything wrong? Rationale. This question encourages the child to think about cause and effect. Spiritual care differs according to the patient's developmental age. For the school-age child, spiritual growth happens as a result of finding meaning in social relationships and applying principles of ethical and moral reasoning. How do you best provide spiritual care to an infant? A. Meet basic feeding needs. B. Hold and rock the infant. C. Play with the infant using brightly colored soft objects. D. Set regular sleeping schedules. Answer. B. Hold and rock the infant. Rationale. Spiritual care for an infant is to promote love and compassion. Building trust and loving relationships is fundamental to development of their primal faith. A female nurse is caring for a male patient who is a follower of Islam. How would this affect the nurse's care? A. Integrate prayer times around care. B. Have the wife present during bathing. C. Provide for a kosher diet. D. Maintain the headdress covering. Answer. A. Integrate prayer times around care. Rationale. Muslims pray 5 times a day facing Mecca with cleansing preparation, providing a washcloth as appropriate. Modesty is important, which implies that it is best to have a male assistant complete the bath. Muslims do not follow kosher diets or use a headdress. A nurse is caring for an American Indian who lives on a reservation. What spiritual practices would the nurse incorporate in care for this patient? A. Storytelling. B. Native American foods. C. Organic-based medications. D. Native American dance and music. Answer. A. Storytelling. Rationale. Storytelling is central to American Indian beliefs. A nurse is caring for a Chinese patient. What question is best to determine religious practices? A. Are there any religious practices I need to know about to help care for you? B. What is your religion? C. Would you like to talk to a chaplain? D. Tell me about your family. Answer. A. Are there any religious practices I need to know about to help care for you? Rationale. Chinese people have very diverse religious practices. It is best to inquire what practices affect care. Do not assume a specific religion. Which interventions are considered helpful to assist nurses coping with the unexpected death of a patient for whom they cared for many weeks? Select all that apply. A. Attending a code lavender with unit colleagues. B. Journaling of personal reflections surrounding the death of the patient. C. Scheduling to work to a different shift than the one regularly worked. D. Arranging a consultation with the unit manager to discuss a possible unit transfer. E. Setting aside time for relaxation activities such as painting, gardening, or exercising. Answer. A. Attending a code lavender with unit colleagues. B. Journaling of personal reflections surrounding the death of the patient. E. Setting aside time for relaxation activities such as painting, gardening, or exercising. Rationale. Attending a code lavender, journaling personal reflections, and setting aside time for relaxation activities are all considered helpful strategies for nurses coping with loss and stress. Scheduling to work different shifts and discussing a possible unit transfer are both forms of avoidance that may result in increased stress and delayed grieving. A nurse is caring for a Hindu patient. What religious practice might affect nursing care? A. Patient will refuse pain medication because pain is due to bad karma. B. Family may bring in hot or cold food and drink from home to help remove toxins. C. Patient may have special head coverings that cannot be removed. D. Religious leaders are usually involved in healthcare decision-making. Answer. B. Family may bring in hot or cold food and drink from home to help remove toxins. Rationale. Hindus integrate both Western and Eastern medicine. They believe that disease is caused by toxins in the body and medicine and hot, cold food helps remove toxins. Headdress and gurus are associated with Sikhism. What is spirituality? A. Practicing religion. B. Expressing meaningful and purpose in life. C. Yoga or other meditative practices. D. Spending time with family. Answer. B. Expressing meaningful and purpose in life. Rationale. Spirituality is the expression of meaning and purpose in life. People have different methods of expressing. Do not assume any one method as universally helpful. How do people who participate in organized religion differ from non-religious people? A. Religious people are healthier than spiritual people. B. Religious people are more spiritual than non-religious people. C. Religious people express their spirituality through faith traditions. D. Religious people have spiritual practices, whereas non-religious people do not have spiritual practices. Answer. C. Religious people express their spirituality through faith traditions. Rationale. Religious people express their beliefs through faith traditions. Research has not indicated that religious people are healthier or more spiritual than those who do not participate in religion. Non-religious people may practice various spiritual disciplines. The nurse is caring for a religious patient who is going to surgery the next day. The patient states that she is afraid and asks the nurse to pray with her, although the nurse is not religious. What is the most appropriate response by the nurse? A. I am not confident praying, but I will think about you tomorrow. B. I need to take care of other patients right now, but I will be back. C. I am uncomfortable praying. May I call the chaplain for you? D. I don't do that. Nurses are not allowed to do that at our hospital. Answer. C. I am uncomfortable praying. May I call the chaplain for you? Rationale. Offering to call the chaplain because the nurse is uncomfortable praying is the best option. Avoiding the subject or focusing on the nurse's feelings or needs is not appropriate and will not provide for the patient's stated spiritual need. The nurse is caring for a 45-year-old woman who is a breast cancer survivor. What activity associated with her cancer experience will promote this patient's spiritual well-being? A. Attending church every week. B. Ensuring her follows the medication regimen. C. Genetic testing on family members. D. Speaking about her cancer experience to increase breast cancer awareness. Answer. D. Speaking about her cancer experience to increase breast cancer awareness. Rationale. Speaking about her experience helps promote meaning and purpose in life. Church attendance does not guarantee time of spiritual reflection related to her breast cancer experience. Treatment and genetic testing assist in physical treatment and risk identification but do not necessarily relate to finding meaning and purpose. When caring for patients who are Jewish, how best can the nurse address their religious needs? A. Order a kosher diet. B. Allow time for prayer before each meal. C. Ask about religious holidays, particularly religious practices around the Sabbath. D. Ask about religious practices affecting care. Answer. D. Ask about religious practices affecting care. Rationale. There are a variety of levels of observance within the Jewish community. It is best to ask patients about what practices will affect their care. Do not assume all persons of faith are equally observant of religious traditions. What is the most important aspect of providing spiritual care in nursing practice? A. Call a chaplain. B. Complete the FICA spiritual assessment and refer as needed. C. Recognize situations and patient behaviors indicating a spiritual need. D. Spend some time in self-reflection. Answer. C. Recognize situations and patient behaviors indicating a spiritual need. Rationale. Changes in spiritual needs happen in the moment, and it is critical for nurses to recognize when a spiritual need arises. The FICA tool is not sensitive to daily changes in spiritual need. Calling a chaplain may be an appropriate intervention when the need arises. Nurses should integrate self-reflection in their own spiritual practices to find meaning in their life experiences. But that is not the most important aspect of providing spiritual care. Which statement by a patient best illustrates reflection on a spiritual need? A. My husband told me what to do about this situation, and I'm sure he's right. B. There is little I can do now to change my circumstances. I just need to adapt. C. I need to think a little more about how I feel about undergoing this treatment. D. Whatever the physician wants to do is fine. I don't have much of an option. Answer. C. I need to think a little more about how I feel about undergoing this treatment. Rationale. Reflection requires intentional thought about a situation to determine how it affects or is affected by the person's beliefs and values. Simply having someone tell the person what to do is not reflection. Adopting a fatalistic attitude or accepting the decision of a physician without inquiry are not reflection either. A nurse assigned to the NICU has spent most of a day working with a critically ill infant, with the mother standing by. The infant experiences a cardiac arrest and does not survive. The mother spends an hour crying and holding the baby, saying goodbye. Which spiritual care interventions are most appropriate for the nurse to implement? Select all that apply. A. If desired, briefly hold the baby to say goodbye after the mother leaves. B. Follow procedures to prepare the body for transport to the morgue. C. Visit the mother the next day to see how she is doing. D. Call the family spiritual advisor or the chaplain. E. Ask the mother if you could call a family member or friend to be there with her. Answer. A. If desired, briefly hold the baby to say goodbye after the mother leaves. D. Call the family spiritual advisor or the chaplain. E. Ask the mother if you could call a family member or friend to be there with her. Rationale. It is important for nurses to take time to say goodbye to patients with whom they have developed a relationship. In this case, it would be appropriate for the nurse to hold the infant briefly. If desired, after the family has left, before preparing the body for the morgue. With consent, the mother needs to be surrounded by appropriate persons to provide spiritual support, including a chaplain, family members, and friends. Although it is critical that the nurse follow procedures in preparing bodies for the morgue, it is not considered spiritual care. Visiting the mother after her loss could be viewed as a violation of professional boundaries, especially for a nurse who worked with the family for only a day. The nurse is caring for a patient who is an agnostic. Which information should the nurse consider when planning care for this patient? A. The patient is devoid of spirituality. B. The patient does not believe in God. C. The patient believes there is no known ultimate reality. D. The patient finds no meaning through relationship with others. Answer. C. The patient believes there is no known ultimate reality. Rationale. Some people do not believe in the existence of God, atheist. Or they believe that there is no known ultimate reality, agnostic. Nonetheless, Spirituality is important regardless of a person's religious beliefs. Agnostics discover meaning in what they do or how they live because they find no ultimate meaning for the way things are. They believe that people bring meaning to what they do. The nurse has been caring for a patient who just died. The patient's daughter is crying uncontrollably, saying, "She was my best friend. I thought she would make it. I don't know what I am going to do." What is the nurse's best response? A. Express sympathy and ask if she would like to talk with a chaplain. B. Give the daughter time to cry in her mother's room alone. C. Ask the daughter if her father is still living. D. Inquire if the daughter would like to pray. Answer. A. Express sympathy and ask if she would like to talk with a chaplain. Rationale. At crisis times, spiritual advisors or chaplains are the best resource with the expertise to address family members' needs. Leaving the daughter alone or inquiring about her father would not provide the emotional support needed. The nurse should avoid making suggestions to the daughter, but instead should seek to identify needs from the daughter's cues. A coworker asks the nurse to explain spirituality. What is the nurse's best response? A. It has a minor effect on health. B. It is awareness of one's inner self. C. It is not as essential as physical needs. D. It refers to fire or giving of life to a person. Answer. B. It is awareness of one's inner self. Rationale. Spirituality is often defined as an awareness of one's inner self and a sense of connection to a higher being, to nature, or to some purpose greater than oneself. Spirituality is an important factor that helps individuals achieve the balance needed to maintain health and well-being and to cope with illness. Florence Nightingale believed that spirituality was a force that provided energy needed to promote a healthy hospital environment and that caring for a person's spiritual needs was just as essential as caring for his or her physical needs. The word spirituality comes from the Latin word spiritus, which refers to breath or wind. The spirit gives life to a person.